Scottie Barnes suffered a left ankle sprain on this play in Game 1, raising some concern about the rookie's availability for the rest of the opening round. Welcome back, everybody. I'm Dr. Brian Sutterer, and better late than never, let's finally talk about Scottie Barnes and his ankle injury. First of all, the mechanism. Of course, this was back in Game 1. Embiid stepped on his left foot, and you can see here how his ankle goes into what we call an inversion type of position, where the outside of his ankle rolls downward towards the court. This is the most common scenario of what we see for ankle sprains, and as we know from his MRI, this was a traditional lateral or inversion type ankle sprain. I'll be honest, I'm very reassured because initially how much weight Embiid put through the midfoot there, kind of on more of his transverse arch of the foot, I was concerned we might be dealing with a midfoot sprain in addition to the ankle injury. So very good news to see that this is just a lateral ankle sprain. And now the million-dollar question is, when will Barnes return? Earlier today at shoot around before Game 2, we see Barnes, of course, he's already been ruled out of Game 2, but here he's wearing a walking boot. Now, some people describe this as a very large walking boot. This is your traditional tall walking boot that we use to help immobilize the foot and more commonly the ankle. Sometimes we will use a short walking boot, which basically only comes up to about this level, typically reserved more for just foot injuries, but this is your standard average walking boot. The fact that Barnes is still in the immobilization phase of his injury recovery raises some doubt in my mind about his availability for Game 3 and potentially even Game 4. Looking at our biodigital anatomy tool here, let's walk through what actually happened to those ligaments and why we see him in this walking boot and what's next for his recovery. What I've shown in this sort of cyan blue color are the typical lateral ankle ligaments. The one that's most commonly injured is this guy right here. It's called the ATFL, stands for anterior talofibular ligament because it's in the front or anterior, and it runs from the talus bone to the fibula. More often than not, this is the ligament we're talking about being injured with a sprain like Barnes had. When it comes to severity of these sprains, we of course hear grade 1, grade 2, grade 3. And if we think of this tissue as the ligament, a grade 1 is basically very small, kind of microscopic level stretch and little bitty tears in the ligament. If you look at it just grossly, you're probably not going to see anything significantly abnormal. But because there still is damage and stretching of that ligament, there's a lot of swelling in the area. And the first step in rehab of these types of injuries is to reduce that swelling and limit the chance that these small little tears become more of a significant partial grade 2 tear. So that's what we're doing here in this immobilization phase. Now, the good news is Barnes is not having to use crutches. Whenever we put somebody in a walking boot for an acute injury, if they still have pain while they're in the walking boot, that's a sign that the ligament is still being injured. The ligament is still being stretched or irritated in some way. And so then we'll put people on crutches. So the fact he's not on crutches is a positive sign. But we try to use the least amount of immobilization possible because the more you can progress to functional rehab, range of motion, more activity, the sooner the better, people have a better outcome. So if we can get by with just using a traditional lace-up ankle brace, we'll usually just do that. The medical staff here is trying to do everything they can to get the swelling down in his ankle, because the more you reduce the swelling, the more you can help facilitate getting back that range of motion, so movement of the ankle, which is step 2 of the whole rehab process. The fact that Barnes is still in a walking boot in that immobilization phase 2 days out from his injury raises concern that he's going to be able to get back out on the basketball court in just a few days. Let's look at the schedule here to walk through this timeline. So Game 1, the day of the injury, April 16th. Some data from Jeff Stotts at In Street Clothes suggests that the average time lost for just a nondescript ankle sprain, which means we don't know the exact grade, is around 6 days. So that data in and of itself would put us right after Game 4 for an expected average return to play that we would see from previous injuries in the NBA. Game 3 is Wednesday, and so I don't see how Barnes can go from being immobilized in a walking boot to playing in an NBA game in just 2 days. There's just too many steps you have to go through. There's too much you have to do to get back out there on the court, in my opinion, to get back and be not only effective, but also safe. Could he try to toughen it out? Sure, but he may not be effective, and there might be a higher risk of repeat injury. If we extend that out to Game 4, now we're giving him another 5 days. So theoretically, there's more time to hopefully get out of the boot by maybe tomorrow or Wednesday, and then have a few days to ramp up his activity. But this is still going to be pushing it. And that's the challenge of these injuries in the playoffs, is every day matters from the playoff perspective, but you're really up against it with optimal rehab time for even an injury as simple as an ankle sprain. So I'll be shocked if he plays in Game 3, just given the fact he's still in the boot. But if we're able to see him out of the boot either Tuesday or Wednesday, then I do think he has a good chance to play on Saturday in Game 4. Otherwise, I expect him back Game 5 at the earliest. Also remember, teams are usually a bit more secretive with their injury details in the playoffs, and so it's possible this is more of a grade 2 injury and Barnes might be out more like 2 to 3 weeks. It's great that he's reportedly feeling better, but to be honest, Walking around in the boot, we'd expect him to be pain-free, and it's important to know there's still a lot of steps to get through, from being immobilized in a boot to regaining your motion to then regaining your strength to then getting back your basketball activity to safely and effectively return to the court. That's it for the video, everybody. Hopefully I eat my words and we see Barnes back out there for game 3 and he's feeling great and doing well. But I think being realistic here, knowing he's still immobilized, I'd be surprised if he was back out here for game 3, and I think game 4, game 5 is probably more realistic. Let me know as always any questions or comments down below, and until next time, we'll see you later.